and welcome to the weekly blog. My name is Dr. David Hutchings, and as always, these are being sponsored by SpectraMed. I wanted to touch on a topic that not only have we been talking a lot about in our clinical labs, but also one that I'm currently seeing with a lot of my patients now, specifically 4 patients last week, and that is the nutritional deficits and weight loss and malnutrition, dehydration, these types of conditions that are associated with dementia and Alzheimer's patients. Obviously, we see these conditions that impact a lot of other progressive neurological diseases and many other diagnoses that we don't even have time to cover today. But when it comes to dementia and Alzheimer's, going back to the dementia staging piece, painting the type of dementia that we're seeing this with, we can see some of the nutritional issues and weight loss come in at different stages. Remember, the staging is 0 is normal, 7 is profound. Typically, in general, when we get to around stage 5.5 to 5.7 is where these are start to not only start to maybe emerge, but we need to start definitely thinking about that. And that's for just in general for more so for progressive Alzheimer's disease. We might see patients that have vascular dementia or Lewy body or Parkinson's with dementia, PDD. These individuals may have these issues much sooner during the illness period. But definitely we want to make sure that that we are referring appropriately. Our goals are to increase weight, nutritional status, hydration, these types of things, overall to improve that quality of life. And so it's very easy to go in on those patients and document that from an insurance standpoint because we can document that there's been a functional change with this patient. So, I do have several that I said just last week that have significant nutritional deficits, which, by the way, kind of snowballs them to having issues with skin integrity. It also puts them at greater risk for developing wounds and other infections. So one of the things that we have seen work, obviously, is the use, if there is actually something wrong with the swallow itself. One thing we have seen a lot of progress with is the use of neuromuscular electrical stimulation and the use of biofeedback, surface EMG biofeedback, to be able to show the patient and they can see the things you're trying to do, which is a little bit easier than explaining things to them due to the cognitive deficit. And the use of E-stem has been shown to really have great outcomes in this diagnosis. So definitely some things to look to. Absolutely, when we get to that mid-stage 5, any kind of weight loss, history of pneumonia, dehydration, these types of things that we would definitely see our patients have issues with. And a lot of times too, they just they'll chew for long periods of time and pocket food and these types of things. And all these things are huge symptoms that and places the patient at a great risk for developing a weight loss or even a hospitalization for a respiratory infection. So be on the lookout for those things. I know that I'm definitely got more attentive to it here recently, just having a few patients in 1 week with this, and definitely investigate using the E-stem approach to help with these patients, as we've seen that it does work, and we have quite a bit of literature to help support that too. Again, we'll see you again next week. Keep the emails coming and look forward to it. Thank you.